to the 7th UKPHR Innovation in Public Health Awards. We're delighted you're joining us as to celebrate the achievements of so many wonderful people, teams, and projects. We'd like to say a huge thank you to our conference sponsors, University of the West of England, who are also supporting our Community Public Health Hero Award. And thank you to Public Health Wales, who are sponsoring the award for improving public health practice to reduce health inequalities. A big thank you also to all of our judges who've generously given up their time to review all of the entries, and without whom these awards wouldn't be possible. Across the country, UKPHR registered practitioners are making a tangible difference to people's lives, often quietly, often behind the scenes, helping communities to be healthier, fairer, and more resilient. Becoming a UKPHR registered practitioner is not an easy journey. It demands dedication, reflection, and a deep commitment to professional standards. Registration demonstrates not only competence, but also integrity and a promise to serve the public good with evidence, compassion, and professionalism. That's why today's awards are so important. They give us a chance to recognize and celebrate those who go above and beyond, those who innovate, collaborate, and inspire others in the pursuit of better health for all. And now on to the awards. Our first award this afternoon is the Collaborative Working Award. Our shortlisted entries are Wessex Clinical Van Return to Care Project. Sean Bowes, Elaine Pierce, Sean Caddy, and Kerry Cameron Green from the Wessex Clinical Van Midlands Partnership University Foundation NHS Trust. Karina Horst and Annabelle Power, UK Health Security Agency. John Gibbons and James Rock, University College London Find and Treat Team. Wendy Wilson, University Hospital Southampton. Chris Heaps, Robert Fair, and Louise Hanford, Hep See You Later Midlands Partnership University Foundation NHS Trust. And Dr. Nick Ballantyne from the Living Well Partnership Southampton. The Leading Systems Change for Smoke-Free Families, a place-based, equity-informed approach in County Durham. Andrea Bracewell and Katie Dunstan-Smith, Durham County Council. Youth Nicotine Prevention Toolkit, Lizzie McLeish and Sophie Jerram from NHS Borders, and Shona Easingwood, Scottish Borders Council. Let's find out a bit more from our finalists.
The Wessex Return to Care project united health services, researchers and lived experience advocates with a really clear aim: to re-engage people previously diagnosed with hepatitis C. But these were people who had fallen through the gaps, felt left down by systems and services, or had conflicted with previously offered treatment.
Our project, Leading Systems Change for Smoke-Free Families, is about reshaping how we tackle smoking in pregnancy across County Durham.
In some areas, 1 in 3 mothers smoked at time of delivery, compared with fewer than 1 in 20 in others. That collective effort is delivering real results. County Durham's annual percentage of women smoking at time of delivery has fallen to 9.1%. Our latest quarterly figure is 4.1%.
Our ambition is to build on this momentum, accelerating the downward trend to 0% by 2030. Thank you.
So the Nicotine Prevention Toolkit looked to address the identified challenge of increased nicotine use in children, young people and families in the Scottish Borders. It was created to support children, young people and families to be proactive in reducing nicotine use.
This project is a true example of collaboration and action. It's the coming together of public, schools, local authority teams, youth sector and youth voice that made it possible. By embedding children's rights and listening to their lived experiences, we've created a toolkit that doesn't just inform, but it inspires real change.
The judges said that through extensive collaborative working and research, this project removed barriers to care through a coordinated partnership approach. And the winner is Wessex Clinical Van Return to Care Project. Congratulations, you're a truly deserving winner. Our second award this afternoon is the Award for Improving Public Health Practice to Reduce Health Inequalities, sponsored by Public Health Wales.
Sinead with your Jim McManus Dewey, cyfarwydd o'r Cenedlaethol Iechyd a Ches Mwyn Iechyd Cyhoeddus Cymru. Hello folks, my name is Jim McManus and I'm the National Director of Health and Wellbeing at Public Health Wales. Our shortlisted entries are bespoke mental health training to reduce inequalities in Buckinghamshire, and that's Rebecca Kineen and the Public Health team at Buckinghamshire Council. The Black Health Improvement Programme, which is Sakinat Bayewu, Mark Adusei and Charles Kwaku Odoi from the Caribbean and African Health Network. And Building Blocks of Health, introducing health inequalities to school children through creative engagement. And that's Rob Anderson Weaver and Lana Mullins at Portsmouth City Council. Let's hear from our finalists.
The initial spark was recognising the important role hairdressers and barbers play in being a place of support for members of the public. Those seemingly insignificant conversations that they might have being the difference between someone sinking or swimming when they're experiencing poor mental health.
From delivering powerful workshops at the local faith setting with over 100 attendees to supporting tradesmen at the local Dewsons.
It's been humbling to see the ripple effect of what tailored, inclusive mental health support can achieve, particularly in the hairdressing and barber sector.
BHIP is a CPD accredited support initiative created by the Caribbean and African Health Network. Its intention is to tackle health inequalities that has disproportionately affected the African and Caribbean communities for such a long time. And currently, so far, we have trained over 2,000 healthcare professionals, and we have reached out to over 200 GP practices across Greater Manchester that recorded 47% increase in knowledge, 92% successful practice change, but currently it has expanded to other areas of London like Enfield and so on. So thank you so much for this recognition.
And what we did is we used these foam bricks and we went into schools to get children thinking about health in a different way. So we got them to think about the people, places and things that help keep them healthy and help them to stay healthy. We engaged over 250 children within the schools.
We actually just loved the opportunity to start a conversation with the children, which is ethically the right thing to do, about the determinants of health, and we framed it in this way with the building blocks.
The judges said this winner was a really impressive submission. They clearly met all the requirements of the award. The team highlighted health inequalities and they made significant improvements, helping people most at need. And the winner is the Black Health Improvement Programme. Congratulations to all the team and very well done.
Our next award recognises a community public health hero. This award is kindly sponsored by the University of West of England. Please welcome co-programme lead Brodie Walker.
The judges thought this nomination was an excellent example of cross-organisational working. The close working relationship between their divisions has enabled a collaborative approach to the planning and delivery of an efficient and essential health protection provision in the community.
Hi everyone, we're the Health Protection team in Aneurin Bevan and we are thrilled to have been shortlisted for the Community Public Health Hero Award.
We work as part of a multidisciplinary team, bringing together expertise and knowledge in public health, immunisation and clinical response, which helps make a difference to health protection issues within our community.
And to be a health hero, we feel that it's vitally important to use our skills as a multidisciplinary team. And one of the best ways of doing that we can think of now is our new vehicle, and we are bringing Grid together, working together to help people live healthier, fairer, safer and stronger lives.
Next up, we have our award for Best Digital and Communications Initiative. Our shortlisted entries are delivering national communications and digital resources to tackle a deadly virus, eliminating hepatitis C, with Grace Massanudo Nuka from the inclusion team at Midlands Partnership University NHS Foundation Trust, Edward Taylor from Hep See You Later, and Candy Lincoln, Hep See You Later and NHS Addictions Provider Alliance. The Power of a Personal Story to Help People Quit Smoking, Catherine Perry, Mark Smith, Deb Parsons, Jane Allwood, Colleen Newport, Kathy Fisher, Alan Joshi John, Katie Haynes, and Laura Willis from Cardiff and Vale University Health Board. Haringey pupils take a stand against HPV. Angharad Shambler, Dr. George Parker, Robbie McDonald, Benjamin Seifert, Dr. Lucy Gold, Damani Goldstein, and Dr. Charalambos Haji Charalambos, Haringey Council. Jude Haste, Rank and File Theatre, Miss Brown and Ms. Ajoku from Grieg City Academy, and Carol Murphy, North Central London Cancer Alliance. Let's find out a bit more from our finalists.
Hep See You Later's engagement programme is a vital part of NHS England's mission to eliminate hepatitis C. Nearly 2,000 people have been tested directly through our materials, individuals who may never have access testing otherwise. We're building an army of informed professionals who can support people at every touch point, multiplying our reach exponentially. Our social media campaigns challenge stigma through education, person-first language, and visibility. This project doesn't just raise awareness, it drives action, reduces long-term healthcare costs, and most importantly, saves lives.
Our team created an inspirational video to share the personal journey of 3 local people who successfully quit smoking using the Help Me Quit service. By presenting real-life experiences, encouraging others to believe that quitting smoking is also achievable for them. Help Me Quit is the single brand for stop smoking services across Wales. Success is 3 times more likely than going it alone if people use a service like Help Me Quit. Winning today would help promote our service and enable more people to experience the life-changing benefits of breaking free from smoking.
Whilst we have fantastic and diverse communities, we also have many challenges and inequalities. Our HPV vaccination rate last year was around 70% for girls and 63% for boys, lower than the national target of 95%.
The Council worked with children and young people to create informational videos. Feedback showed us that there was an improvement in knowledge of the HPV vaccine. We worked with an external digital marketing agency to launch a paid campaign so that the videos were seen on platforms where the young people are, primarily Snapchat.
We shared these videos with all of the schools in Haringey. We're really proud that we created an innovative set of resources that can be used for many years to come.
The judges said this was a great example of data-driven work delivered through a multifaceted program, and the winner is delivering national communications and digital resources to tackle a deadly virus, eliminating hepatitis C. Our huge congratulations to all the team. Next, we have our award for Best Sustainable Initiative. Our shortlisted entries are Making Every Contact Count in North East and North Cumbria with the Department for Work and Pensions, Craig Robson, Lisa Davies, and Jill Harland, Northumbria Healthcare NHS Foundation Trust, and Kay Charlton, Department for Work and Pensions. Adoption and implementation of the NHS Healthy Weight Declaration, the Northumbria NHS Trust and HWD Steering Group, commissioning a sustainable mobile dent health service, Dentaid, for inclusion health populations in Wigan and Lee, Anna Sheehan and Jill Kelly, Wigan Council. Let's find out a bit more from our finalists.
Last few years' work, which has been focused on implementing the guiding principle of making every contact count across job centres in the northeast of England, which has been focused on educating staff across our job centres and telephony services with the Department for Work and Pensions, so that then when they interact with customers that are on universal credit or looking for employment or learning opportunities, that health promotion has been woven through those interactions where it's been suitable.
The NHS Healthy Weight Declaration is a framework developed by Food Active. We are the first trust to adopt the Healthy Weight Declaration post-pilot, and we are also the first trust to launch jointly with our 2 local authority colleagues to support a whole systems approach. And we've made some great progress over the last 3 years, including review of our food and drink offer, development of our healthy meeting guide, development of a weight stigma checklist, development of our active travel infrastructure. We've supported our staff. We have developed helpful conversations about weight training, which has been accredited, and also a training resource to go with that.
The DentAid project is started in 2019, and after putting a survey out to some of our homeless populations, it was apparent that their oral health was really important to them and was holding them back. So Anna commissioned the DentAid van, that's what it is, which goes into communities rather than expecting people to go to dental practices, which didn't work. So it went in, and some of our homeless people managed to get lots of restorative work done, extractions and cleans, and it really did change their life around. So thank you so much to Anna.
The judges thought this work clearly supported creating healthy environments and demonstrated a whole systems approach through their sustainable initiative. And the winner is adoption and implementation of the NHS Healthy Weight Declaration. Our congratulations to all the team. We will now move on to our Employer of the Year award. Our shortlisted entries are Knowsley Council, Wigan Council, and City of Wolverhampton Council. Here's what our finalists had to say.
Knowsley, it's an area of high deprivation and faces some of the toughest health inequalities in the country. But what sets us apart is how we respond, with compassion, courage and commitment. I'm incredibly proud to work for an organisation that truly invests in its workforce. It's created a culture that enables and facilitates learning and continued professional development, including encouraging and supporting employees to become registered as UK public health practitioners.
Our submission is all about the wide range of support that we provide to our workforce, in particular to develop our public health practitioners.
What we can say is that the learning and the development opportunities that we've had as a team, they allowed the time to work on things like bite-sized sessions, journal clubs really benefited me and my colleague.
It's been an incredible journey. It's improved my confidence in public health. It's made me realise how much my work already aligns to the public health priorities.
Our project is about building a skilled, future-ready public health workforce, and we've created a really supportive environment where the UK PHR registration is not just encouraged, it's embedded within our culture. From day one, all our practitioners are guided through a registration journey, and they can access dedicated learning and development through a hub. We also get everybody involved, and we have invested in an innovative programme such as our registrar-led lunch and learn sessions, which align directly with our UK PHR Know How, Show How standards.
The judges said this employer was a standout example of an organisation that goes above and beyond in reducing health inequalities to ensure people live longer, happier, and healthier lives. And the winner is City of Wolverhampton Council. Congratulations. And that concludes our awards ceremony today. Congratulations to all our winners and finalists, and thank you once again to our sponsors, supporters, and of course to all of you for joining us. On behalf of UKPHR, I want to thank every practitioner, every assessor, every mentor, and every partner who's supported this journey. You are at the heart of public health practice, and we're genuinely excited to celebrate your achievements today. This ceremony and the winner's guide will be available on the website shortly for you to share with friends and colleagues. Thank you again.